Good afternoon everyone. Today we will be discussing about how to fill the forms for a suspected case of COVID-19 in St. John's Medical College. Before we do that, there are certain general instructions which every clinician and every paraclinical staff should follow. That is, we have to inform local, district and state authority about the case which has come to our hospital, especially the surveillance officer, for further guidance. That's the first thing. The second thing which has to be done is to seek guidance on requirements for clinical specimen collection and transport from nodal officer which has been appointed for these patients. So, this is a form which has been provided by ICMR and NIV through link, and it has the following columns. The first column contains epidemiological details of the patient. The second column contains exposure history, that is 2 weeks before the onset of the symptoms. The third column contains underlying medical conditions and also history of hospitalization or treatment before coming to St. John's Medical College. So whenever you are filling a form for a patient of COVID-19 and giving samples with it, what you have to do is you have to fill these columns very thoroughly, and these have to be sent to the microbiology lab after filling. The last column has specimen information, that is the nasopharyngeal swab, which we will be demonstrating how to collect. That nasopharyngeal swab has to be collected and the specimen information has to be mentioned here. That is the specimen which has been collected, the date of the collection of the specimen, and also the label number of the specimen. After doing that, you have to give your own details, that is name, your designation and email ID, which will be provided by Microbiology Lab. If you have any doubt while you are filling the form, what you have to do is you have to refer to the second page of this form. This form has total 4 pages. The first page is for details of the index case. The second page gives you case definition. Case definition of severe acute respiratory illnesses and case definition of individuals with acute respiratory illnesses of any degree of severity. This is the third page, which is for surveillance of the passenger of COVID-19 or the people who have been in contact with index case of COVID-19. This form is very simple to fill. It also has only 2 sections. The first section deals with the demographic details of the patient, and the second section deals with 2 symptoms, that is fever and cough, and the number of days for which that was present. And this is the fourth and the final page, which contains details and cumulative data of all the passengers who were in contact with the index case, and this has been provided with all the forms. You have to remember 2 things. First is, either form has to be filled before you handle any sample, number 1, or sample collection. The second thing is that if you are collecting the sample before filling the form, then you have to collect the sample, discard your personal protective equipment completely according to biomedical waste management of St. John's Medical College, and then you wash your hands and then fill the form. Please make sure that form is not filled with the hands which have the same gloves which have been used to collect the sample of the patient. Now we will be demonstrating how to send a sample to a microbiology lab. So these are the components of the kit which has been provided by microbiology department to all the wards in our hospital. It has a Ziploc bag which has 2 swabs. One swab has been provided to collect the sample from posterior wall of pharynx. The second swab has been provided to collect the sample from both the nostrils. The other component which we have in this Ziploc bag is a bigger centrifuge tube. This bigger centrifuge tube has a small viral transport medium tube. Before you start taking samples, please label the centrifuge tube properly with patient name and demographic details. So, how you proceed is that you open the swab like this. At mid of the swab, there is a line which is the point where you break the swab once you have collected the sample and you are transferring it in viral transport medium. It has to be transported like this, that is after collection. Then the swab has to be broken with applying a force on the area at midline of the swab. Viral transport medium tube containing the swab has to be put back in the larger centrifuge tube, which has to be tightly screwed back so that there is no leakage of the sample. After that, the centrifuge tube has to be put back in the Ziploc bag and has to be sent to microbiology lab after completely filling the form correctly.